Hello everyone. Today I'm going to talk about the COVID-19 management at home. First, what we have to understand is COVID virus doesn't kill directly, overactive system immune system kills. Nowadays, hospital admissions is difficult to get bed and expensive, 70,000 to 5 lakh in a week, and which is very stressful conditions. And the stages we have to understand about the stages after infections. First, viral replications occurs, and then for due to these viral replications, our immune system activates and inflammation occurs. In most of the cases, COVID will end up at this stage, and it is also called natural cure due to our immune systems kills the virus. If the our immune system cannot cure or cannot kill the virus, then immune hyperactivation occurs and hyperinflammations. It is also called cytokine storm. At this stage, due to this stage, the respiratory failure occur, and the multi-organ dysfunction can occur, and due to this multi-organ dysfunction, the death can occur. How to identify these stages? The stages one is viral replications. It approximately lasts for 1 week, which is usually asymptomatic. The stage 2 is immune activations, which is mild symptoms or sometimes asymptomatic. In stage 2, the mild symptoms can be like fever, cough and sore throat, body ache, loss of smell, mild breathing difficulties, and diarrhea can occur. What do you need to do? First, you need to find out the lab nearby you. The lab tests include CBC, or complete blood count, CRP, or D-dimer. For oxygen saturation or SpO2, use oximeter. For temperature, use a thermometer and count respiratory rate. What medicines to be taken at this stage? Paracetamol 500 mg 3 times a day for mild fever, or paracetamol 1000 mg 3 times a day for high grade of fever. Budesonide inhaler 800 mcg 2 times a day. Zinc, vitamin C, and vitamin D can consume. When to step up management? If the CRP level is more than 5 times upper normal limit, if the D-dimer is more than 2 times upper normal limit, and in CBC, neutrophils or lymphocyte ratio is more than 3 times, then add dexamethasone 6 to 12 mg daily, or methylprednisolone 30 to 40 mg 2 times for 5 to 10 days. There are certain side effects of steroids like dexamethasone or methylprednisolone. Blood sugar level might increase. It may also cause gastritis. Use glucometer to check blood sugar 6 hourly. Inject soluble insulin according to sugar level. If the sugar level is 150 to 200 mg per dl, then 2 units of insulin needed. If the sugar level is 200 to 250 mg per dl, then 4 units of insulin. If the sugar level is 250 to 300 mg per dl, then 6 units of insulin is needed. If the 300 to 350 mg per dl sugar is there, then 8 units of insulin is needed. For gastritis, tab pantoprazole 40 mg twice a daily can consume. Now, talking about the stage 3, stage 3 is also called hyperinflammations. If not cure stage 2, then stage 3 occurs. If the SpO2 level or oxygen saturation is less than 93, or respiratory rate is more than 25, add oxygen to maintain SpO2. SpO2 is more than 93 to add oxygen to maintain the SpO2 level more than 93, and enoxaparin 40 mg, which is given subcutaneously once a day. How to deliver oxygens? Oxygen is delivered through the nasal cannula. 2 to 6 liter per minute, and simple face masks. Through the simple face masks, 6 to 10 liter per minute. If the oxygen is not available at home, then prone positions increases oxygenations. Due to this, the precious oxygen requirement will be less. These are the things possible to manage at home up to this stage. Okay, and the critical decision at home is dexamethasones. is the dexamethasone or methylprednisolone is the game changer here, which are steroid, I already told, and it must be started at the proper stage when inflammatory marker CRP, D-dimer, or CBC, in which CBC specifically N is to L ratio, start using this. Don't wait for the SpO2 to fall, okay, at this stage. And if the dexamethasones or methylprednisolone starting too early can increase viral load and disease becomes more severe, okay, starting too early, okay, once again, starting too early can increase viral load or disease become more severe. The starting too late can lead to the lungs damage beyond manageable at home, okay. So we have to use the brain at this stage. The stage 3 is cytokine storm. It is a very dangerous for human body, and overactive immune system occurs, further reduction of SpO2 or oxygen's level, and further increase in respiratory rate. So we need to hospitalize the patient and needed oxygens and ventilator. Thank you.